safe and secure. Ni sawa.
Now, physicians have decried a huge deficit of specialist doctors in the country, which makes it hard for them to offer patient-centered healthcare. Speaking in Eldoret during the 27th Kenya Association of Physicians Scientific Conference, the medics further stressed the need for the involvement in the formulation of policies at both the county and national levels. The experts further called on Kenyans to go for normalized regular checkups in order to prevent or manage some diseases before they escalate. The conference attracted more than 400 physicians from different parts of the country.
And how we look at is, what do we make of the guidelines? We have international guidelines, and we'll have the first two talks before we go to January 4th.
Effort is needed to develop the effective prevention and mitigation strategies to overcome the high health and economic burdens posed by the chronic kidney disease and SGLT2.
We found that there's clearly a gap in research. We keep talking about Western numbers, but we're not generating enough data and research on where the problem areas are. And one of the gaps we've noted is, one, we need to work in cohesion as all societies in the country. Number two, there's a clear deficit in terms of training and then in terms of management and screening. So this year we are focusing on, instead of encouraging patients to come to hospital when they're sick, how about presenting earlier just for medical checkups? Because when you present initially to the clinic, the nurse will screen and check your blood pressure. You probably came for a flu, but then at the end of the day discover you have diabetes and high blood pressure. And lucky for you, if a specialist is on board, we start you on management so that you don't end up on dialysis, which would have come 10 years earlier. We can actually postpone that because clearly there's a staggering difference in terms of economic expenditure.
Probably 80% of the 400 physicians we have are in the major cities. So a majority of our population are not getting the services of the physicians. So one of the things Kenya Association of Physicians has done, like several other associations of physicians within the region, called EXACOP, which comprises Kenya, Uganda, Tanzania, Zambia, Zimbabwe, and Malawi. We are training physicians and deliberately training the physicians outside the major cities. Because, you know, universities have traditionally been in the major cities. Now, in that regard, and evidence has shown that if you train, the quality of care improves within the training sites. And this is really what we are getting up to.
Now, Kilifi County leaders have been urged to work together so as to forge development.